Anything else tonight, trustee Burback?
No, sir, that's it.
Oh, I thought it was on approval for today.
I just.
No?
Discussion.
Oh, okay.
Okay, then we'll move on to trustee Caveney.
Thank you, Mayor. The first thing on the agenda is the MWRD property buyout State Farm Building. I'm not sure how that ended up on my agenda, because it says it was placed on there on October 2nd, which was Monday, and I didn't put that there on Monday, so I'm not exactly sure how that ended up there, and I don't have an update on that.
Okay.
The last time we spoke about this, the village and MWRD had conversation, we finalized.
Did you read what it says for that? Motion to approve Popeye's zoning variance.
Weird motion.
So I think
Yeah, that's weird.
that's how
I
it
don't-
wound up on there.
I
And
don't,
it says submitted by Kathleen Caveney.
wait, no. I'm not sure, but I don't know, but I didn't put number 1 on there. So I really don't know how that got
I
there.
don't know is not a legal defense. I don't know is not a legal defense.
Twin, Katie Caveney.
I don't know. My evil twin must have busted into my computer. I'm looking at number 1.
Yeah, that the description, public content is motion to approve Popeye's zoning variance.
Under public content.
Yeah, I don't know why it says that.
Okay.
I'm looking at my computer and I've got it, I clicked on number 1 and it's highlighted in yellow. And I can see that it says motion to approve, but that was supposed to be under number 2.
Okay, so you have no update on number 1?
No, the only comment I'll make on number 1 is that the village did send the final document with our final approved comments back to MWRD. And those were comments that MWRD was aware of, the people we were dealing with, Rich Fisher and his team. And they sent it on to their legal department for their blessings, so we're waiting.
And
I
I
got the
did-
names of the 2 appraisers. I'm gonna send those to MWRD by the end of the week for them to review.
I did forward the information packet that the grant writer needs for the GIGO grant to David and Joe Sperry.
Okay.
For them to fill out. We'll be submitting that on the 18th.
Okay, very good. Okay, next item on my agenda, number 2, approval of ordinance 2130, an ordinance granting the zoning variation to allow the gross number of square feet of display area of the signs on a lot located at 14536 South Pulaski to exceed the linear street frontage. This is with regards to the Popeyes zoning variation request. So I'd like to make the motion to approve ordinance 2130.
I'll second.
Any discussion? Roll call, please, Clerk Musk.
Trustee Caveney.
Aye.
Trustee Crawley.
Aye.
Trustee Burback.
Aye.
Trustee Johnson.
Aye.
Trustee Killy.
Aye.
Motion carries.
Thank you very much, everyone. Deputy Clerk, if you could email me the signed ordinance tomorrow or whenever you get it, and then I'll forward it on to Popeyes. And then my last couple comments, the property at 3825, 3831, 147th Street, that I lovingly refer to as the White Elephant, the former liquor store, that the judicial deed is in the hands of our law firm. He sent a copy of it to us yesterday, so Deputy Clerk and her team are gonna send the transfer stamp back to them, so we should have the final deed. It should get recorded hopefully by the end of this week or early next week. And then we can move forward to come up with a plan to dispose of that building.
Is that
And
going to
then-
the land bank though?
Pardon me?
That's going to the land bank.
No, we did that directly.
Okay. All right.
The village did that directly because the thought process was, because it's in a floodway,
Mhm.
and because the building is in, pretty rough condition, and Superintendent Witt's not with us any longer, I will run this by the powers that be with FEMA and IDNR to confirm that it can't be repaired or rebuilt upon because it is in a floodway. The thought, because we need parking in our downtown area, the thought was that we would tear that building down and make that one big continuous parking area. If we can do something to rehab the building and keep it as a retail space, then we will. But otherwise, it's gonna be torn down. I did walk around the building last summer with Superintendent Witt, and he pointed out a couple of really rough spots on the exterior walls, so not sure that it could be rehabilitated within the guidelines of FEMA, within FEMA's guidelines. Fall Fest. I want to thank the Midlothian Events Committee for helping me to run this event this year. Our Fall Fest will be October 29th from noon to 3, and the theme this year is, I just had a mind cramp.
Celebrating our heritage?
Right. Oh, sorry, Scarecrows Around the World, thank you. Scarecrows Around the World, celebrating our Midlothian's diversity and honoring our ancestors. So, everybody dig through your closets, it's time to reuse, reduce, recycle. And that's all I have.
15207 Lawndale?
Oh, 15207 Lawndale. 15207 Lawndale has been listed by Harside Realty, and we do have an offer pending. The village we've not accepted the offer yet. I believe there might have been one or two other interested parties that had contacted Lenny File, and he was gonna be having conversations with them. And so hopefully by next week, we will have an accepted offer on this property already. Yeah, so very
Excellent.
exciting.
Thank you.
Mhm.
Trustee Kiley?
I guess I'm gonna try to compete with trustee Caveney today, but anyway. Meetings, Natalie Creek Trail meeting, 2 weeks ago or last week, I don't know, I've lost track of them. Anyway, phase one, good news, phase one is done. We were waiting for IDOT to approve some things, and they called up our engineering from Terra last week and told them that it's approved and they're waiting for the paperwork. There's no additional engineering fees due for that one. So, on to phase two. We have an ITEP grant for $780,000. That is an 80-20 grant, I found out. So, the 20% of that grant will be shared by 5 communities. Also, the quick estimate for the engineering fees and the acquisition of property, which is $300,000 by itself, will be somewhere in the area of 1.2 to 1.3 million. So it will exceed the grant. Now, is there other ways to try to get more money? Invest in Cook. They've already given us phase one. I don't know where that's going to go exactly. Phase three, engineering. So I asked the engineer, Tara, because on phase one, they give estimates of what the construction costs would be for each area. So I asked them just in general, what's your estimate for Midlothian? Now, Midlothian, the Natalie Creek Trail is going to benefit us. It's going to enhance the sidewalk to a trail from Kilbourne to the train station. And also, it's going to widen and enhance the trail from Natalie Creek from Costner to Pulaski with lighting. So it's going to be a split one direction on each side with biking and hiking. That's definitely going to make our downtown area more accessible. So that's the good news. The bad news is that, the other good news is we think we're going to get money from the federal government for 1.3 million. Again, an 80-20 grant. The estimated construction costs for what is projected to be done in Midlothian is 6.6 million. So the question is, would somebody come up to us all of a sudden and say, well, you owe 1.3 million for the construction costs, or 6 points, or whatever it's going to be, or the difference between the whatever grants we get? It's probably going to be piecemeal because we've already got grants from the federal government, Invest in Cook, and ITEP. ITEP grant, the 780,000 one, the maximum for the project is 2 million. I don't know if we're going to get any more from anybody, so it'd probably be slow, but I want the board to know, and, the question is, from our end of the deal, do we want to do this? do we want to go forward with Natalie Creek? Phase one is done, we could say, no, we're out. But again, the creek will benefit us, I think, and also will benefit the area for, walkability, bikeability all the way from Blue Island to, and then on the west side to the Cal-Sag Trail around Route 83. So we have time to make that decision. The committee isn't gonna meet till sometime early next year because they have to get the engineering estimates a little bit for phase two a little bit tighter. And then we can talk and see if there's any other funding sources. I want the board to know, think about, do we want to invest that kind of money? Maybe not all in 1 year, but over a period of years into Natalie Creek Trail.
What are you anticipating the village's cost would be in total? I'm sorry, I know you threw a
Well,
lot
right
of
now,
numbers
right
out.
now we have a grant for 80% of 1.3 million from the federal government. It's 6.6 million total construction costs. Can we get extra grant money? I don't know.
Wait, is the 6 million construction cost for the whole thing or just for Midlothian's
Midlothian.
portion? And that would be it, so we applied for that $6 million grant?
No, we gotta do the engineering first.
We did, we got
Well, I thought that was the-
1.3 million.
Oh, okay.
Well, wait a minute.
Old
I thought
Forest
we
got-
already, I thought that, didn't we have a big meeting at the
Yes.
Park District
Yes.
about the engineering? I thought the engineering for this was already done.
No.
Well, what was all that engineering
That was phase
for?
one, and we had to do that to get phase one approved. IDOT wouldn't have approved anything unless we did that.
Okay, but what was the phase one engineering for? Wasn't it for the whole trail?
Design.
Phase was a design, it doesn't have
Okay.
engineering.
So right now, at a minimum, without any additional funding, the village would be looking at 20%,
Of 6 million?
No,
no,
no.
20% of 1.3 and the whole 6 million.
Yes,
Unless we got a grant for that.
unless we got grant. It's possible.
Okay, so the 1.3
Invest in,
is for the engineering?
yeah,
Okay.
Invest in Cook, this round, did give, quite a few grants for, bike trails.
Mhm.
They're big on that, but the maximum grant that I saw was 500,000.
Right.
Wasn't 6 million. The federal government, we already used the TAP, which was suggested by Leslie Fiebstrom from SSMMA, and she thought that it was the best thing we could do. If we want this to go on, it's gonna be a piecemeal type of project, and we might do one piece of our trail at a time. How soon it would be connected to everything, I don't know. The Cal-Sag Trail took probably at least 10 years to come to fruition, at least. So, but the question is to the board and to the finance committee, but larger than the finance committee, how important is the Natalie Creek Trail to
We should at least get the
Midlothian?
engineering done.
Pardon me?
We should at least get the engineering done, so. if
Well,
he's
the
ready to go to
okay, but there's a
construction-
gap on the engineering right now. Now, we'll see
Right.
if we could get more money to pay for that and see where we're going.
We got a couple months for them to redo the numbers on the engineering.
Yes,
and then we'll find out a little bit more about where we are. Okay.
And sometimes there are grants out there that you can use to cover the village's portion, right? So,
Well,
Sometimes they pop up. I don't know.
sometimes they
$6
pop
million?
up. I don't
no,
know.
on the engineering,
I
on the
don't know,
engineering
I don't know
part.
who they are, but, because we've hit all three, but I'm not sure. Maybe they'll go for a second round. That's very possible. I'm not the grant
So
person.
John, would this be a great opportunity for the grant company that we're engaged with to go out and seek funds to help close that gap?
So I think the problem is right now, the Natalie Creek isn't just Midlothian, it's 4 other communities too, and we're only one community that, I'm sure they would do it for us, but they're not gonna put in.
Well, we're the lead,
Grants. But
So
they're not gonna
whatever-
do grants for other neighborhoods.
They would do it not free, not under our contract.
Right,
But we
right.
are the lead.
They'll
For
work with
Natalie
us,
Creek, yeah.
but someone will have to
Right.
pay them.
So Don, have you thought about getting together with the 4 communities to say, here's what's going on, here's the situation, we can give this much, how much can you give, it's gonna benefit all 4 communities?
5.
And perhaps they may have a little
Five,
stash
4, sorry.
that they can
1,
help
2,
with it
3,
too. 'cause
5 communities,
Yeah.
sorry. But I mean, the bottom line is there's only, Oak Forest religiously shows up at the meetings, nobody else. So we'll see where we're going, but I just want the board to be aware of what's going on. Number 2, today, there was a South Suburban Land Bank meeting. I'm very happy with the South Suburban Land Bank. They're very forward-thinking. They are big picture people. They are getting their act together. They employed a consultant who was a GIS computer consultant. He's getting not only our website, but there's a lot of systems that are to keep track of the real estate, and there's a lot of things happening.
Intersect Illinois,
Pardon me?
Intersect Illinois.
That's what we're using.
Mm-hmm.
Well, it's actually software that we contracted with, unbeknownst to us, before the former director left, from a land bank in Ohio, which is the best land bank in the country. And it's an awesome system. We can try it out for a year, and it looks like it's going to fulfill our needs perfectly.
Well, we already have one that we're putting on our website for
Well-
economic development.
Well, I know,
And it's
but
free.
I know, but this has this has tons of
Have you
different
looked
parts.
at ours? It's pretty
It
good.
has maintenance, it keeps track of maintenance, everything. It's like got 15 different parts to it. So, because there's a lot of different moving parts in this whole thing. So they have 13 new real estate agents. Their sales are 28% above what last year was, and they have a substantial pipeline for next year, for the first part of next year at least, very substantial, $2 million. Hopefully that comes to fruition. They have made a partnership with Cook County Land Bank. Cook County Land Bank is giving South Suburban Land Bank 30 properties that they're getting from the suburb. Cook County Land Bank is totally overwhelmed with everything. They have no, so they're giving our land bank 30 properties to work with and splitting the proceeds. A good partnership, they're all working together, and we're hiring very good talent. Just to give you an idea of that, we had a young lady who was the director of real estate for Mayor Lightfoot. She came to work for us as the director of real estate for the land bank. She's leaving. Her new job is going to be director of the labor department for the state of Illinois. So, I mean, they're hiring really good people. They're really on it. They showed us the plan, and it's step by step, makes perfect sense. And they might actually get to the point where they're actually doing land banking. When we originally joined the land bank, Mayor Stevens and myself wanted to join the land bank because we wanted the land bank that would accumulate properties in a certain area that a municipality would like to develop, and the land bank would keep them until the municipality had all their ducks in a row, and they would accumulate these properties, let's say for parking or development or whatever it's going to be. And we thought that was a great idea. Midlothian couldn't do it. We wanted they would do it. Well, they never had the money to do it. Now that's their ultimate goal, to do big picture developments. I'm very excited about that. So that's something, I think that's good news, because the land bank was down and out there for a long time. Third thing, when you get done, I know Trustee Johnson, you talked about the Fall Fest at the Park District. And when you get done with that, there's also another nice event at the Forest Preserve on October 7th. Awe of Nature, it's sponsored by the Nature Conservancy in tandem with the Forest Preserve and a couple other agencies, Village of Markham. And they will actually lend bikes to people, as I understand it, and they can walk and bike the trail. There's free food, face painting, games, so all sorts of stuff. So you can have a whole, it's from 11 to 3, you can have a whole day of fun. And the kids will be worn out and everything. So, but it seems like it's a good thing. I mean, the Fall Fest I know will be great from Park District too. That's all I have.
Thank you, sir. Trustee Crowley.
Thank you, sir. Just a couple things tonight. I did send a follow-up email, and on my agenda for discussion this evening is the annual renewal of the village's employee and retiree insurance. I know it was riveting information, and everybody read through it and, thought it was fantastic. I did make a couple recommendations. I was just wondering if anybody had any additional questions or input, or felt that we needed to have Horton here to go over all of the statistical data and information that they do before we can make this decision next week. We do have to vote on this next week so that our health insurance is seamless and we have all of our ducks in a row, because if everybody remembers, the village made a conscious decision to do a hard registration, is that what we're calling it? Not a soft.
Not a soft register, everybody has to re-register,
Yeah,
right?
everybody has to register every year to make sure information is updated and correctly. So we need to make sure we have plenty of time for our employees to do that.
For an open enrollment you're talking about?
Right,
Is that what I not said?
Open enrollment.
Yes, open enrollment, sorry.
right.
And really, the only two things that we have to make a decision about is the switch from Blue Cross and Blue Shield, from iWinds to Blue Cross and Blue Shield for a supplemental policy for our retirees over 65, and the $50,000 one-time credit. My recommendation was, yes, to do the switch from the iWinds to the Blue Cross and Blue Shield based on Horton, our insurance, what are they called?
Brokers.
Broker.
Thank you. Our insurance broker suggestion, they basically told us that the Blue Cross and Blue Shield offers our retirees more benefits, they cover more costs, and at a greater savings. So at their recommendation, I'm in favor of that. And if anybody had any questions, or if you guys feel you need Horton here, I could ask them to be here next week. But otherwise, I will have this on the agenda, and I know Trustee Killaley has something to say.
I do have input. So, I just want to just talk real quickly, hopefully, about Medigap versus Medicare Advantage. Medigap is the government making decisions on Medicare. Medicare Advantage is private insurance companies making decisions on healthcare. It's supposed to be in line with what Medicare rules are. That's the contract they sign. However, Medicare Advantage companies are for-profit, obviously, the insurance companies, and so they want to make as much as they can. And I have Medicare Advantage myself, so let me just say that. But the big thing with Medicare Advantage is you have private companies making decisions. They try, and I just asked my doctor, I think Monday, I asked him, I said, because open enrollment's coming up, I says, is there a better insurance company for Medicare Advantage than what I have? He says they're all the same. He says they all try to tell the doctor how to treat the patient. If you have an expensive test, or you have to go to the nursing home, or if you have expensive treatment, they will try, and frequently do, deny initial coverage. Now, that doesn't mean it's going to be denied at the end. It means you have to jump through a whole bunch of hoops.
Kind of like our current health insurance.
Mine too.
Yep.
Right, right. So it's worse than our current, I'm just telling you. But in the end, probably 5 to 8% of requests for insurance or claims are denied, and of that, they did a study, and only 13% of that was wrong. So it's not like they deny everything, they don't, but there's basically the difference between Medicare supplement, Medigap, is the government makes the decision. They have no dog in this hunt. As long as it lines up with the Medicare rules, they're fine. And very seldom will you ever get questioned on it. Very seldom. Maybe you didn't fill out a code right or something. It's not the same with Medicare Advantage. Now, I don't have a big problem with switching to Medicare Advantage as long as the retiree can go to private insurance, and that's not quite so easy. I asked our broker if Blue Cross would offer both Medicare Advantage and Medigap, and because we have a small group really they really got us in under the wire. We're not, it's supposed to be 50 and over lives. We don't have that, but they accepted us for Medicare Advantage anyway, but they won't offer both. If the retiree wants to go to and keep their Medigap, they have 63 days. Well, what I was told from them was they have 63 days to switch back and buy somebody else's Medigap insurance from a private insurer. They also, from what I've been reading, they also should have 12 months to do it, because the first time you switch from Medigap to Medicare Advantage, you have 12 months to switch back. That's something the broker didn't say, which I'd have to confirm. And the third thing is that, according to what I've read, Blue Cross offers Medigap to anyone in any health condition, and without denying or rating them. But I just got this in the mail today from another insurance company. This is the Medigap stuff. It's got 4 pages of health questions. And they have choices here. If you answer yes to any of these questions, you won't get covered. And then there's 2 other sections. If you answer yes to any of these questions, we'll charge you higher premiums. I know the board wants to do the best they can for the retirees, and the big thing is that Medicare Advantage, the premiums are less by far than Medigap. But the big thing is that Medigap has their Medicare Advantage usually will have a higher out-of-pocket cost. Now, in this case, I don't know if that's true. I'm not totally sure that that's.
I'm not sure what you just said.
I'm with you.
Well, Medicare Advantage, how do I say it? Medicare supplement pays more insurance claims right out of the bat. With Medicare Advantage, you might have more co-pays, okay? So the big thing is, yes, I do want Horton to come forward with more information. If you could switch it within 12 months, I think that would be fine. You know,
I don't know what you're talking, I'm not sure what you're asking.
okay,
Don.
so.
You lost me,
So
sorry.
here, the thing is, you can't switch back and forth.
Well,
you
right,
can't-
but Don, that's with any of our insurance. It's open enrollment once a year.
No, never. No, it's never.
You
It's
mean
not.
once you pick it, you're stuck there?
Well,
Well, that can't be because
No,
we're
yeah.
switching now.
no. You
He's
can
talking
switch from Medigap, you can switch from Medigap to Medicare Advantage, but after a certain period of time, whether it's 63 days or whatever days, she said it was 63 days under open enrollment. If you go past that time, you can't switch back to Medigap without going through this packet of health questions. And
But when that whole year is over, when you get to do
Nope,
open enrollment again, you
nope,
can't
nope,
switch?
nope.
So however, if they go to a Medigap plan, then they would no longer be able to participate
That's
in the
right.
village's retiree program. So.
That's right.
So,
But the premiums are less, so I don't know what to say. I really hesitate. You know, it's sort of like if we offered our employees one plan and we said this was the plan
So.
And I know we don't wanna
Chief,
do
maybe
that.
you can, and I'm sorry, I don't wanna put you in the middle of this, but
Because you're on
I,
Medicare, right?
Oh, my
by
God.
the time we're done with him, sir. No, but what I heard from some of our employees is that we used to offer a Blue Cross and Blue Shield supplemental plan for retirees. And
Okay.
we went to Amwins because it was cheaper and it had less benefits. So,
Originally, when we went to ambulance, it was because Blue Cross was telling us that our retirees and employees were in the same census and we were paying way higher premiums because our average age was up. It wasn't because of, ambulance was cheaper and Blue Cross was cheaper when we switched to, because we have a lower,
So-
employee age.
based on the information that we were provided, the majority, under the Blue Cross and Blue Shield plan, retirees will now be entitled to hearing insurance, vision
Right.
insurance, and
Right.
dental insurance, which they currently are not entitled to unless they pay for it themselves,
Right.
correct?
Right.
And then the retirees will also be entitled to lower costs monthly for 95% of their prescriptions.
And also, and the initial premium is less by far.
Right, and the initial premium is less by far.
By 8%.
All of the other comparable co-pays and things like that were the same or less based on what they provided us.
Right.
So I guess, and they will now have the entire Blue Cross and Blue Shield network to be able to, it's a larger network than they would currently have
They
based
have
on
anybody right now. They have
Well-
anybody in the country.
anybody that accepts Medicare.
Yes, and that's the same, and Blue Cross
Right,
has
but they'll
it.
have, but again, it's only people who accept Medicare. Now, if
Right.
they accept the Blue Cross, they'll, it'll be a.
Anybody accepts Medicare in Blue Cross.
So what is what are we concerned about?
The
What, like, if
concern
we-
is that people will find out that they don't like being questioned about their doctor, about if you need a treatment or a test or so on and so forth, or you have to go into a nursing home for rehab. They don't like having their claim held up for,
And this is happening in how much percentage?
a lot, and everybody's doing it. All the, it's not just Blue Cross, it's everybody. But the bottom line is, from my own experience, I was supposed to get a CT, they stopped that, because I didn't get any physical therapy before that. That was making a lot of sense, that's what they were trying to figure out, if I could have physical therapy with
To
that.
begin with.
To begin with, and it just made something up, because CTs are expensive.
So did you then get the CT?
4 weeks later. No, I never got the CT because we dropped that, but it took them 4 weeks to approve it. Now, if you're sick in the hospital with a serious illness,
I guess for me, though, that's what our employees do now with Blue Cross and Blue Shield. If they have a claim, they have to get approval, and, I mean, that's what
No.
most of us go through.
not as much.
I'm gonna concur with Horton's recommendation. They've done us well, I believe, so.
Oh, I agree. I just would like to know that we're doing the best we possibly can.
Okay.
I think it's 12 months.
I appreciate your passion, but I have no idea.
Well, when you get to be over 65, you will get totally
And I will
confused.
come to you and you.
No,
give
you
me
won't,
advice.
because I was sitting there for 2 days looking at everything too. So, no, it's very complicated, but, 50% of the people in the country have Medicare Advantage, 50% have Medigap. 50% of the people in Medigap love their Medigap, 50% in
What's
Medicare.
Medigap?
Medigap is.
Why?
We're not-
Medigap
Why?
Medigap is government,
We can move on now.
fine, and that's all.
I'm gonna have this on the agenda for approval next week.
Okay.
If you have anything you'd like to say.
Well,
I
if the
think-
mayor and myself can sit there and talk to Horton over the phone, then that's great. I think everything could work out where they have a decent time to choose, but I don't know. Aren't you? And the second
My
part.
recommendation
and the
is what
second
Warren
part-
told us.
Yeah, and the second part of your thought was?
I don't remember
The
that.
50,000.
50,000.
Oh, the 50,000, I mean, I think that we should split it 80/20 with the employees.
I agree.
So those are my two recommendations. That's the motion I'll be making next week unless trustee Kelly hits me over the head with something. Other than that, we do have a Community Policing and Safety Committee meeting this Thursday, and next Thursday is our Traffic Safety Committee meeting. So that's all I have, sir.
Thank you, ma'am. Attorney Valdez?
Just that next Wednesday, we will be presenting before the board an ordinance vacating and transferring a portion of 146th Street and the alleyway between Harding Avenue and Springfield Avenue. That is the Springfield School Project. They are very anxious to get going, so that will be before you next week. That's all I have.
Thank you, sir. I really thought I had something, but now I'm all worried about Medicare and Medigap, so I forgot what I was gonna say. Did I talk about Trip C project? Did I talk to the board about that?
No, not recently.
Once again, thanking MWRD, they are stepping up to purchase the 3 properties that are in Midlothian, taking that off of our plate. So all we'll have to do is maintain it once it's done, so. Everything else looks like it's a go, from Crestwood's standpoint, and Bremen Township's not really adding much to the project, but that was our big concern, that we were gonna have to purchase 3 properties, and could have been substantial amount of money, so, once again, MWRD has stepped up and is helping us out with this project, so. That's not what I was thinking, but
Chris is gonna take care of their part, because they don't today.
that's all gonna get redone, and well, when it's done, there shouldn't be any issues. Okay, that's all I have. Clerk Moscow.
I have nothing for you.
You sure you want to talk more about Medicare and Medigap? Okay. See, there's no further business coming for the board. I'm looking for a motion to adjourn.
I'll make the motion.
I'll second.
All in favor?
Aye.
All opposed? Meeting adjourned. Thank you all.